diagnosis means. Okay? When you start going out into the field and you start reading these evaluations, you're going to see a secondary diagnosis, and typically that's like muscle weakness, inability to ambulate. Those are typically the two major secondary diagnoses. So when you are looking at that doesn't really tell you a whole lot, does it? So it's important for you to know what the primary diagnosis is in order for you to best treat that patient. So you find that information in the medical history, which should be in the medical chart.
So would you say that then the secondary diagnosis is more of like the long-term and the primary is like what caused that long-term?
The secondary diagnosis is related to how it's coded for Medicare.
Okay.
And it's a rehabilitation code typically. Okay. The precautions or contraindications, can you give me a couple of those from the class? What would the contraindication
Weight
be?
bearing.
Weight bearing is a good one. What'd you say?
I just said non-weight bearing.
Okay, non-weight bearing, okay. Anyone else have any ideas of what?
For precautions or which one? Either
Hip
one.
motion.
Either
Hip precautions.
Hip precautions.
Back.
Cardiac is very good.
Range of motion?
Range of motion would be good if they had orders that limited their external rotation.
Any type of surgery.
Yeah. Orthostatic hypotension would be good.
Would meds be in part of that or no?
No.
Okay,
Well, medication, no,
okay.
no. A contraindication may be a pacemaker or a defibrillator. Any kind of, sometimes any type of a metal part, such as a hip replacement or total shoulder, any kind of prostheses that may be inside of the person could be a contraindication because, and also the pacemaker defibrillator, because if you are to use electrical stimulation, diathermy, ultrasound on those types of patients, they can have an interruption of the electrical cycle. Okay, so that's why it's important for you to know if your patients have a pacemaker or implants within them. A breast implant, you can pretty much do whatever you want. It's not a contraindication for any of the modalities. Okay? The reason for referral would be to OT, and typically that's written on the evaluation from the occupation, from the evaluating occupational therapist. The reason for discontinuation of the therapy services could be they met all their goals. They went to the hospital, non-compliant, meaning that they don't want to participate in therapy. So those are 3 reasons why you would discontinue therapy services. Then your name is always on the report. Then you're going to describe the OT intervention. And it talks about the duration and frequency of interventions, which would be like 5 times a week, 1 time a day for 6 weeks. That would be the frequency and duration. Basically, or you could just write the number of visits per week and then the whole time frame, like 5 times a week for 4 weeks. You'll see that a lot on your evaluations, or 6 times a week for 6 weeks. This is the intervention I'm still talking about. The number of intervention sessions. Now typically in the old days, we had to go back and count every single time we saw that person on the paperwork. We had to count it. But now the wonderful technology that we have has that number for you on the computer, so you can fill that space in on the document. And that's important because of payment services. Medicare or your insurance company is going to pay you on the number visits that you went to the therapy services. The beginning and end dates of the interventions, when was the first day of therapy? The first day of therapy is the day that the occupational therapist evaluates that person. That's when it starts. And then the last day of therapy is whenever you or someone in the therapy department saw that person. Typically, you do not see a person the day of discharge because Medicare won't pay for it or insurance won't pay for it. So if I'm being discharged tomorrow from therapy, today would be my last day of services.